Performing an eye exam in a child is really challenging, especially if they're very young. They tend to be uncooperative and they will probably get upset during the examination. See if they're able to fix and follow with each eye open. Normally they will get quite bored during this part, so try and keep their attention. If you are struggling to get their attention, you could try using toys or even some treats. When assessing pupils, look for a good red light reflex in both eyes, then go on to have a look for direct, consensual and an RAPD for the pupils. To check for the alignment, have a look at the corneal reflexes and make sure they're symmetrical. You can try using the cover test, but it's normally quite difficult in the very young. When looking at the movement of the eyes, obviously make sure the head's nice and still. You can try the doll's head maneuver, but it's not always well tolerated. Using a trial frames on a child is normally quite difficult. They don't fit very well, they can be quite uncomfortable, and the last thing you want to do is upset your patient. You can consider letting the patient play with the equipment just to help them feel more comfortable with it, but it can backfire on you. Now, retinoscopy is quite difficult. You do need to be quite quick with young children, but if you do manage, hopefully you'll get a rough idea of what the glasses prescription is. And I wouldn't bother trying subjective refraction in a young child. Always look at the front of the eye just to make sure there's no anatomical changes. Use dilating drops to allow you to have a really good look at the back of the eye. Make sure you use the right drops depending on their age. When looking at the back of the eye, you've got a few options. You can try using a direct ophthalmoscope. It does involve you getting quite close to the child though. If you do manage to get a look at the back of the eye, follow the vessels back and you should be able to find the optic nerve. Another option is indirect ophthalmoscopy. It does involve you using a 20 or 30D lens and is a bit trickier to do, but if you manage, you'll get a nice field of view. So that concludes the examination. Make sure you always thank the child and congratulate them for doing so well. You really want them to remember this being a positive experience because you may need to examine them again. If you did enjoy this video, please check out the charity which I'm supporting. It's a wonderful charity called the Amber Trust. Amber's vision is to give blind and partially sighted children the best possible chance to fulfill their musical aspirations. Well, thanks for watching and we'll see you next time.